In the old days, myself and Dr. Hallstein would come, two docs, we'd have everything covered and life was good. It was much simpler. Nowadays, that's not enough. So we have specialists across the board. I have, luckily, 40 partners who can do everything in musculoskeletal medicine you need. Plus, as you know, Dr. Chris does all our concussion work, and he's a world expert at that. So to deliver the highest quality of care that Brown athletes really require and should have, we assembled a team that I think is second to none.
We started out just the two of us, Dr. Fideli and myself covering, and over 20-something years it's become quite a team. We cover everything head to toe. Orthopedic sports medicine is my specialty, but we have primary care sports medicine now, ranging from treatment of head injuries to primary care sports medicine issues.
I think the medicine is why most of us went and did this fellowship in sports medicine. It's what we wanted to practice. So compared to our daily practice, which is a little bit more of general orthopedics or general medicine, this is sports medicine at its highest level, and we have great rapport with the student body. We interact with them on a daily basis, quite honestly, in our clinics, but also here over on the Brown campus and covering games.
Yeah, I really like the variety here. I think we do have an extremely robust athletic program, and I think it makes me a better doc to be able to not just take care of football and basketball and hockey and all the other sports, but some of the more unique sports like fencing, crew, these sports that have as well amazing athletes, and you get to learn about the sport. And really a good sports medicine provider needs to know the sport, needs to understand the specifics of the position, of the timing, and needs to get down in the weeds on the sport in order to connect with the athlete. And that certainly helps me as a doc, being able to connect with athletes both at the collegiate level and also in the community.
The number one goal is to give them good medical care and give them good advice about what the best options are, and that's true for anyone. I think once you get to higher levels, like collegiate might be different than high school, they can start to make some decisions that are more about for sport than they are for other types of commitments. But I think in the end, it's trying to make sure that they're safe and they're healthy and that they're preventing injuries.
Oh my God, I absolutely love coming over here. So as you know, we teach physicians to be surgeons, and we treat and teach residents and fellows. And I tell them, in our offices, you have the weekend warriors mostly. You go over to the VA, it's another type of patient. You go to the clinic, it's a third type of patient, but when you come to Brown, boy, you better be on your game. These kids are incredibly gifted, they're great athletes, and they're incredibly smart.
I say the level definitely changes things, and we take care of athletes from professional through collegiate, high school, all the way down to youth sports. Certainly as you progress up that ladder, the stakes are higher. Certainly an NCAA championship hanging in the balance, or a professional contract hanging in the balance. The athlete is certainly willing to probably experience a little bit more risk than we usually ever allow with the youth athlete, where it's just not as, well, it's often important to the athlete, but we have to balance it in the greater scheme of where that person is in development. But certainly our experience with professional and collegiate athletes informs our decisions, even with weekend warriors. The concepts are the same, but certainly the level of risk involved is a little bit different.
It's a long-term and longitudinal relationship. So these are people that we may meet during their freshman year, and some of them stay on and they're fifth-year seniors and they're still playing. Some of them come and do clinical internships with us in research, or have interest in medicine themselves. So these are people that we get to know fairly intimately, not just through their sport, but as students and as people. So it's very rewarding.
It's rewarding. They're great people to be around. It's fun to be in the locker room. It's fun to be in the training room, and especially fun when I can be on the sideline, watching the game, enjoying the game, and I see no injuries. So that's my best day on the field.
I think, without sounding silly, these athletes are magical. They really are great kids, and I'm old enough that I can say that. They will thank you, they're appreciative of everything you do, they're giving it their all. And so for me to interact with these types of kids who are just pure winners, it's kind of like a shot of adrenaline. You leave here and like, wow, I'm surrounded by these really great, appreciative, nice, successful kids. Now, how could you not go home at night and say, it's a pretty good day?